This is Transparency, a podcast by Gender Dysphoria Alliance, hosted by Aaron Kimberly and Aaron Terrell. Each week we'll be joined by people who have personal or professional experience with gender dysphoria and physical transition. We'll also discuss how our trans experiences relate to the concept of gender identity. Join us for a compassionate yet heterodox approach to the question of trans. Courtney Coulson is an Australian detransitioner and YouTuber exploring the real psychological and social motivations behind gender dysphoria. In this conversation, Courtney discusses a topic not nearly covered enough on this podcast, which is the role of online fandoms in rapid onset gender dysphoria and motivating adolescent females to transition. A quick note to listeners, Courtney is a quick thinker and this conversation takes a lot of interesting turns. So if you're like me and often listen to podcasts with the speed increased, best to leave this one at 1. Without further ado, here's our conversation with Courtney Coulson. All right, welcome back to Transparency. I am Aaron Terrell. He is Aaron Kimberly, and we are very excited to have Courtney Coulson here with us today to talk about her experience of gender dysphoria, transition, detransition, and everything in between. So thank you so much for being here, Courtney.
Glad to be here, AA Ron squared.
That should be a new title. Awesome. So I would like to start for you because you maybe start here. Like, how old are you currently, and how old were you when you first transitioned, detransitioned, and like to kind of place all that experience in the kind of cultural current moment?
It's only just occurred to me right now. So I'm 32, and realizing, I transitioned when I was 22. I'm so old. How did this happen?
10 years passed.
Well, yeah, somehow 10 years passed, which honestly kind of makes me feel a little better about it. Oh yeah, wow, I was a different person. It was a different time. I first heard about transsexuality, so it's a wholesome Catholic suburban schoolgirl, very sheltered, and didn't know what a transsexual was. And then I was talking to a drag queen that I'd met at WAPA, the West Australian Academy of Performing Arts. I studied costume design there. And he was a drag queen. I went, so this drag queen and this transvestite, because obviously I've seen Rocky Horror, so I know what that word means. And then this transsexual, I think, also heard that word in Rocky Horror. That's my only understanding. That's my only frame of reference. So what do all those words mean? And so he broke it down. Okay, so that's a drag queen. That's a transsexual. That's a transvestite. Oh, okay. And that was I was 19 years old. Oh, okay, interesting. Good to know. And that was the end of that line of thought. And then around 21, that's 2013. Yeah, I suddenly developed this rapid onset gender dysphoria, decided, all my problems, all my life, they must have been gender dysphoria. It makes so much sense. But on my YouTube channel, I break down all the things that it actually was, including autoandrophilia. But I mean, I keep discovering new things all the time. I read a lot of science, neurology, psychology books, and the most recent thing I've discovered, which may be applicable. Sorry, this is a long intro. I just need to.
No, go for it.
I've been suffering with what I've called phantom pain. I was hit by a car, not last year, but the year before, and I just have this all over pain, and it's not quite what do they call it? Persistent pain, not quite fibromyalgia, it's not quite this, neuralgia, all those things. It defied conventional diagnoses. And I've recently discovered, what's happening is there's nothing structurally wrong with me anymore. My brain has this conversion disorder and may always have been prone to that. So a conversion disorder particularly affects individuals who struggle to communicate their emotions. They may have had a traumatic background, autism, any sort of mental, neurological, or psychological issue, preventing them from making sense of their interoception. Sorry, I'm trying to keep this as straight as possible. When you are not really able to connect with your body, understand what it's feeling and how to react to that, you are more prone to these conversion disorders. And what I'm starting to realize is, so not only is my brain converting stress, PTSD, whatever, into physical pain, I think that's probably what's happening with a lot of individuals who transition, and especially those on the autism spectrum, because we know they have alexithymia or alexithymia and low interoception. So that's probably what happened to me. I don't know if I'm autistic. Long story there. I just got my medical records from when I was a child. Woo! My mother. Oh, we'll get into her in a minute. But yeah, I think I had poor interoception. I didn't have adults around me who were able to go, ask me. He said, "Courtney, how are you feeling? Could you try to describe what's going on in your body? What's going on, just in general in your life, in your head?" I don't think we're doing that enough with these kids, especially the more intelligent, introverted, complicated kids. And so they're going to leap on to the main, the most popular problem at the moment, the cool problem, the sexy problem to have. That was the same thing with the repressed memories and eating disorders and cutting. And we have these sort of fads, these trends with mental illnesses for some reason. And so, yeah, I think that's what is happening. But there's also, tying into our topic of today, the sexual component. So, and I see you have the auto-heterosexual book on the shelf there. So the others, so maybe in one of my videos I said there's probably two motivations as to why someone transitions, and it's either you're homosexual or it's auto-heterosexual. And now I'm wondering maybe if, autism and neurological conditions like that can kind of fit to the middle, or they're in the Venn diagram. We'll see. So
I think they very, very often overlap with the second category. I think.
Yeah.
I think that whole turning inwards can cause the autosexuality. But yeah, go on.
So now I'm wondering. It all comes down to interoception. If we had to even get it lower beneath, there's all these circles, these layers. So yeah, there's the sexual orientation is one thing, but I think at the very, very bottom, this is my new discovery, interoception. And so if you're gay, if you're an heterosexual, if you're autistic, if you're any of those, I've noticed with these individuals, what they suffer with is, I have a desire to be in the world in a certain way, and I want to wear these clothes, or I want to be able to have a sexual relationship in this kind of way, or I'm a woman, but I'm attracted to women, and I would like to have sex in a kind of heterosexual way. So there's that. Or, well, I'm not attracted to others, but I'm attracted to the idea of myself as the opposite sex. So it's your interoception. There's something gone awry with how you perceive your own body, what it should be in your mind versus what it is.
It's blowing my mind. I think you're really onto something here. That's very interesting. Okay.
Well, see, I can listen to audiobooks all day at work. I'm a seamstress, I'm a furniture upholsterer. So for the 7 hours a day, 4 days a week, can't work full time yet, I was injured. But anyway, for my work week, I'm just listening to science books. It's really handy.
Nice. You can continuously absorb new information. While working.
Data, that's great.
Yeah.
It's interesting because there is a study by Zucker and others that where they did an MRI study, and they did find, and I don't remember now exactly what cohort they studied, but they did find a difference in the area of the brain thought to be related to perception of body. So yes, I mean that tracks with what you're saying.
Yeah, I think I've read that same study. It was on trans identified women or trans men. I always have to say both, just in case my audience doesn't know which is which. So being very clear. But women born female, identifying as male, they would touch the trans man's chest. I think there was like a brush or something. They would brush over the chest, and they would try to detect any differences there. And yeah, there was less sensation, or there's less integration of those senses. I can't remember this. It's a long time since I've read it, but something about they weren't feeling their chest the way other people normally would. And it wasn't to do with surgery, by the way. This was, I think, pre-op. Well, they did pre and post-op, but on the top of my head, yeah, there was some unusual difference there.
That tracks.
You can tell I've been on the internet for a while, and then I have a lot of commenters correct me all the time, because now I'm doing, okay, just to be clear, okay, I have to cite my sources and make sure I am being as clear as possible.
So if you want to like go back to, yeah, you were talking a little bit about when you were young, something about your mother in there somewhere, but yeah, what's your early life experience of gender dysphoria? It sounds like you weren't even conscious of the idea of transition until you were 19, 20, but what was your...
Yeah, so I was always a tomboy and didn't develop any sort of sex drive, which now I'm wondering, and I need to do a video on asexuality. I've been meaning to do it for a long time. There's a lot to delve into there. But I do, honestly, now I am of the opinion that asexuality is a pathology. It is not a sexual orientation. Human beings need to reproduce. Is one of the most fundamental things. It would be as if you had no desire to eat or sleep. Well, that's a pathology. That's not just a type of being. You need to have those drives. And having been asexual, I can tell you, it also affects the way you interact with others as an adult. You are losing this subtext, this unspoken communication. There's this dynamic between men and women, or even people of the same sex. There's just something I was not getting. And
well, we should kind of unpack the what you're describing as asexuality, though, because I think a lot of people hear asexuality and they think lack of sexual desire altogether, which is not your situation. Your experience is of a lack of allosexuality, a lack of an external sex drive.
Yes. So, and that was something I kind of had to come to terms with very late in life, and putting it into place of, oh, so that's why I wasn't looking at others in the way. So, everyone else is hitting puberty. They're starting to be interested in each other. I'm not interested in other people, but I start to have these fantasies about being bigger and more masculine and all that. And I didn't really put two and two together as, oh, is this a sexual orientation, or just I identify with these male characters. I think it would be nice to look that way. I want to be treated differently. So that's where I feel that heterosexuality is not, and Phil Illy talks about the same thing. It's an orientation rather than a fetish, because I think fetish just means it's this instant gratification at this specific stimulus. But it goes beyond that, because it's more about how I would like to be treated this way, or seen this way, or interact with the world in a certain way. So it goes beyond the bedroom, just a masturbatory exercise. There is some sort of gratification there that goes beyond that, which makes sense. That's why people would want to transition. That's why people cross-dress. It goes beyond just fetishistic gratification.
Yeah, I think that's why it does a disservice. And I'm not even saying, oh, it's not right for autosexuals to describe it as a fetish. I just mean like it's counterproductive to describe it as such, because very few people with that experience relate with it being a fetish. Like, it just doesn't feel that way. And so it's you're not convincing many people when I was like, oh, it's just a fetish. Like, no, it's not. So nobody's going to identify with that framing of it.
Yeah, I think maybe you would say transvestite is probably the better term for someone who it is purely a fetish. They love wearing women's underwear. They'll masturbate women's underwear. They have sex while wearing women's lingerie. But the rest of their life, they just go through as a man. They have no issues with that. So there's a complete separation between their private life and the public life. There's no conflict there. And that would be the same thing. Like BDSM, the most probably famous fetish or sexual subculture. And for those individuals, it tends to be just in the bedroom. It doesn't extend out of that, although I have been research or ages ago. I was researching into the service submissive. So there's a subculture where these are married couples who there's the dominant, there's a submissive, and they live out that role 24/7. So again, that calls into question: is it an orientation? Is it a lifestyle? Is it a fetish? So I would say, at least in my unqualified opinion, it seems that it's almost a spectrum. I know that word's used a lot, but it does go from, okay, this is just a little bit of fun in the bedroom, to I kind of like doing this all the time, to this is my identity now. I think that's all on the same continuum. I don't think they're different things.
Yeah, that's a good I'm thinking with BDSM, that could be like a kink or a fetish specifically reserved for sex, or then it can be extended out to the entire life. But what that's it's still not an orientation. It's still just going to be like kind of making your fetish your lifestyle.
Yeah,
And so I still think that'd be a different thing than that
different
subconscious internal
fetish. Yeah,
compulsion to be that which you are attracted to. I think that's more
yeah.
a much more base level thing.
Yeah, do they go fetish to lifestyle or fetish to orientation? Are those the same kind of on the same track? That's the fascinating thing about psychology is you are trying to create a narrative through phenomenological data, I guess. We are witnessing, for example, lots of teenage girls suddenly wanting to be boys. What labels do we put on that? How do we describe that? How do we explain what's happening and why? And I was someone who has had to do a lot of research recently on that, but also onto, I'll use PTSD, not to bring that. I'm trying to stay focused, but this is actually relevant. So with PTSD, I've read so many books on different perspectives on what is happening. Is it a neurological thing? Is it the brain is overreacting to stimulus, or it's interpreting all stimulus as negative? Is it a kind of a brain trauma? It's yeah. There's just so many theories about, well, what actually causes this and what's the mechanism. Ultimately, they may all be right. Maybe they're all wrong. It's nothing you can truly quantify. And that is why we have these never-ending philosophical discussions about transsexuality, auto-heterosexuality, because we see the behavior, but the underlying mechanisms, I mean, that goes beyond even our most advanced screening, MRI, brain imaging. We don't have the ability to decode the human brain like that.
So you decided at some point to transition. Where did you
Mm.
where did that concept where did you encounter that idea? What about it appealed to you? I mean, obviously what you kind of described earlier makes sense why it appealed to you, but yeah, eventually you came across this idea, decided to go down that path. You want to talk about that?
Yeah, so I guess we go to all the way back to the beginning. Maybe not early childhood, but so I am the only girl. I got two younger brothers, and I think my mother, I think she was narcissistic, although she's developed traits of that uh, later on in life. But yeah, when I was a little girl, she just wanted. Well, the funny thing, so I was born bald. My brother's full head of hair. I did not, and my mom really, really wanted to be able to tie my hair up in the little little fountain, little ponytail thing they put. I don't know. Everyone wants to do that to little girls. It looks so stupid. Stop doing that. Do it to little boys as well. Um, but yeah, so maybe that was a sign from the beginning. You're not going to have this little princess that you wanted. And always into boy stuff, always into whatever my brothers were into, Transformers and what was the other Small Soldiers and all those sorts of movies. We were watching all those sorts of things together. Although they watched Saddle Club with me. I don't know if you have Saddle Club in the rest of the world.
I don't know.
Okay, the Saddle Club is a bunch of girls who have horses, and that's what the TV show is all about. And my brothers watch Saddle Club with me. So, at that age, you're not really distinguishing gender in any specific way. And that was my experience until I hit puberty. It was this beautiful world of bliss where there was no boys things, girls things. We all loved Pokemon. We all loved Lord of the Rings and Harry Potter. There was no distinction. And then puberty happened, and it was just devastating for me. And I don't really know why. My mother was the one who suggested I might be autistic, which is weird because all my childhood development up until that point was normal. I had no difficulties in school. The more research I'm doing, I'm writing a memoir. I'm doing a lot of digging into early childhood school records. My academic performance was great in primary school, and had no issues with friends. I mean, I was a bit of a lone wolf. I was happy to be alone or with other people. I didn't mind kids playing with my toys. I was kind of cool with whatever. I really wasn't an anxious kid. I just went with the flow. And then, well, I've pinpointed it to this specific thing, and this is the only working theory I have. We'll never know the truth definitively, but for my 11th birthday, I got gastro. And I just was not right after that. I think there's something happened with my gut microbiome, my immune system suffered, my food tolerances went way down. I used to eat whatever. And then I was sick all the time, had IBS symptoms. This is before FODMAPs, and no one was even giving me that kind of help. Just eat more fiber. No. And then my personality really changed as well. But because I'm 11 years old, going through puberty, they go, oh yeah, she's just going crazy. It's like Carrie, female puberty. It's just a real bitch, I guess. No, there was something really wrong. I was reading so I got my medical notes. They go right back to the age of 10. Everything's fine until 11 or 12. Oh, well, she's getting into fights in school. She's having these meltdowns. Academic performance is way down. She's having all these social and sensory issues. She has all these paranoid delusions. But my mum she took me to one therapist. Only after she went to my GP, I'm reading in the notes, she went to my GP and said, oh, I've been doing some research, and I think my daughter is autistic. So my GP writes, well, she's been doing research. Yeah, it seems like Courtney has these symptoms, so we'll do some further investigation. So I'm referred to, it was actually a couple of therapists, and both of them said, oh, she's a complicated case. We want to see her some more, but we don't believe in labels and putting kids in boxes. We won't just jump straight to autism. We think it's something a little more complicated. And that was just earth-shattering to me. Because the way it had been told to me when I was 12, 13 years old, my mum showed me the letters. Going, can you believe? Look at this ridiculousness. They don't believe in putting kids in boxes and labels. You need this autism label. Oh yeah, you're right, mum. These idiots. No, if I'd actually been able to read that letter, and with the maturity I have now, going, no, they're just saying it's not a textbook case. Whatever this is, something else is going on. We need to do further investigation. Take our time. All my mum wanted was the autism diagnosis so that I could get exemptions at school, maybe get on the disability pension. I don't know what her plan was. She's a lunatic. But yeah, that was earth-shattering to me, realizing, oh, so the story I'd always been told is way more complicated. And maybe it was a conversion disorder, that I was going through puberty, I was going through all these changes, I didn't know how I felt or how to communicate that. And then my mom comes along and says, it's autism. So I start doing research on autism. And I think, oh, maybe this is it. And then even my father commented, it seems like your autism symptoms are getting way worse now after the diagnosis. Oh, you're just being ableist. That's all I said about it. And okay, we dropped it. But I think he was absolutely right. I think because I'd had this idea put in my head, it became a lot more exaggerated. And later on, I think I was susceptible to the transgender thing as well, because I had these confusing feelings about my sexuality. It's just, I think women are attractive, but I can't relate to them. But do I want to be with them? I don't know. I didn't have a normal sexual orientation at that point to guide me. I just had all these confusing feelings. But at the time, this was late teens, early 20s. I'm spending a lot of time on Tumblr. Oh, before we get to that point, always wanted to be a bodybuilder. I am now bodybuilding for myself. I don't know if I could ever compete, but yeah, I'm building muscle, not trying to look like a man, but now I'm back at it, having detransition. And I feel great. I feel really comfortable and going, I think that was an element too. That for whatever reason, yeah, I am more comfortable being more masculine. I like my deeper voice. I like my hairline. I like the muscles. But as a kid, seeing female bodybuilders on TV, everyone around me, my brothers, my friends, my dad, or even my mom, go, ew, that's disgusting. They're like, man, so I'm sitting there going, oh, that's so cool. Oh, it's not cool. Oh, okay. I should feel ashamed about that, I guess. So I think those subconscious things played a factor as well. A lot of trans men, lesbians, and the like have difficult relationships with their mother. I definitely do. She has a very conservative, traditional perspective on what a woman should be. And I think if I had a mother who said, you can be whatever you want, you can wear whatever you want, cut your hair however you want, cut your own hair, go ahead, I'm not going to stop you. That would have been great to have a mother who was so supportive and said, explore, discover who you are. You don't have to be me. It doesn't matter what you do, I'll still love you. My mother, on the other hand, you should wear these. I'll give you all my hand-me-downs. You should dye your hair red because my hair's red. We'll both be matching. We'll do all the matching things. And yeah, no, I was conditioned to be her little mini-me, to do the things she wanted, to buy the things she wanted. Yeah. And it's taken me a long time to untangle that. It wasn't outright abuse, but I was neglected. I was alone. I was misunderstood. And so then comes along the Church of Transsexuality. I'm on Tumblr in my teens. And also, by the way, the medical notes, the psychological notes say a lot of things. That she seems lonely. She seems depressed. She seems, disconnected. All those sorts of words. No, why didn't anyone do anything about it? So I spent a lot of time online, on the Tumblrs, and this is the height of Super Wholock, Supernatural, Sherlock, Doctor Who. And these are shows that are very male dominated. These are not shows that portray women as diverse, as powerful, as compelling as the men. No. The women in these stories are side characters. And so I think a lot of girls who transition or identify as non-binary or what have you, I think that's a huge factor as well, that you look around at your media and you don't see any women like you. They're sexualized, they're in the makeup and the heels, and they're just there to be the object of the hero's affection or to be rescued, the damsel in distress. So yeah, I think that was definitely me when going, well, I feel more like the male characters and I feel cool when I dress like them and I wish I had the body like them and all these things. And so it builds this fantasy, and there was this erotic aspect to it as well, which I didn't quite fully understand back then. But once I got on testosterone, I think that erotic aspect, because I'm on testosterone, definitely increased, even if I wasn't still. I'm very oblivious. I still wasn't aware of what this was and what was happening.
So you're absorbing this. I remember that the super hulock content on Tumblr. And also that's the thing with Tumblr is the around that time, the all the kind of fandoms, be it the Harry Potter or the British super hulock stuff or whatever, it's all intertwined with the gender ideology stuff. So it's like because all that activisty stuff was on, both were on Tumblr simultaneously. It was attracting all the girls into the fandoms, and then all the the postmodern queer theory stuff. We didn't know that it's not explained as that. It's explained as um, well, just the way things are in the good progressive way to be. And so these girls who go on there very innocently We had Helena Kirshner on a long time ago, and she was went through this in very thorough detail. She was brought to Tumblr for all the for classic rock content, like 13, 14 years old, and then that merged into Harry Potter stuff because she was really young and she liked Harry Potter, and then that got merged into the fandom, like the slash fan fiction stuff, and then that's merged in with the queer kind of trans celebration stuff, and so it's like this
The
this
slash,
funnel.
yeah. Sorry, the slash stuff. I think I do mention that in my auto heterosexuality video, but yes, there's so many trans girls, trans men, so girls identifying as trans or non-binary, all that. They are all, a lot of them are really into the slash or the yaoi, as it's the Japanese term, and they love looking at some pretty hardcore erotic art of male on male action, usually anime or manga. And my theory, someone else told me this, and I'm like, that is so true, yeah. That why women connect more with it goes back even to, like, I don't know how it could be Sherlock and John Watson back in the 19th century, but we definitely know for sure that women were super into was it Spork, Kirk and
Hmm.
Spock. That is the OG ship. Later on, it was Miami Vice, Tubbs and Crockett, and women were really into these guys having erotic relationships together. Why is that? Well, it's because any heterosexual relationship is lopsided. The power dynamics all wrong. Women want to be able to feel powerful and equal to a man, especially if you're heterosexual. You look around in fiction and porn, especially porn, it's just horribly degrading. There is no story where there's a man and a woman who are equal standing socially, power dynamic. It's not a love between equals. In Slash, it is equal a lot of the time. Or okay, maybe some women get obsessed with the top and bottom thing, but still, it's still better. If you're a bottom as a man, you still have a higher status than a woman in this erotica. But yeah, I think a lot of it comes down to that, where girls watch and read this stuff and think, yeah, I would feel better in a gay male relationship. That's the wild thing, is these girls transition and then they want to be with men, but then realizing, oh, I'm attracted to heterosexual men who are no longer attracted to me because now I'm a man. So it's sad. It's a circle that just trap themselves in. They're chasing a fantasy.
With the inundation of porn. So yeah, everything you're saying is accurate. I totally agree with it. About the girl's motivation, but I think that porn thing is making it so much worse. Because there's that same motivation of not liking that power imbalance relationship. You just perceived power imbalance. Aaron and I were just talking a little bit earlier today about this. He was saying that a lot of like lesbians will be drawn to the idea, or women will kind of be drawn to the idea of being a lesbian in order to achieve that egalitarian relationship. So they may be more attracted to men, but they don't like the power imbalance inherent in a heterosexual relationship. So they identify as women to solve that problem for themselves. And as we've seen, a lot of those women then go on to transition into trans men. And then now that they're a man, socially, sexually, they go on to be a gay trans man, so they can, actually sleep with the people that they're attracted to, which are men, and they feel like it's now equal. So I think that's what was happening long ago. Still a bit today, but mostly.
Uh, what was the term? It was tranny maxing. I found that quite funny. So some gay men transition into women so that they appeal to straight men or something.
Yeah, yeah.
That's wild.
Oh yeah. I mean, it
Yeah.
makes more sense. That makes more sense to me. The whole male HSTS thing. It seems like a pragmatic solution. We can talk about the ethics of it or the good, whether or not it's a good decision. But it's such a directly pragmatic decision to me. It's like because their sexuality does not change, right? Whereas female sexuality very often does. And so, and then again, when you got the young these girls who grew up not just in the Tumblr fandom space and absorbing the gender ideology content, but at the same time, you've got this hardcore violent porn that overly dramatizes, exaggerates, whatever, that inherent power imbalance of the heterosexual dynamic. It just puts it on steroids. And so these girls will and see this and go, oh well, I don't identify with the this sexual dynamic doesn't appeal to me, therefore I'm a man. Like, it's just like they're literally that simplistic.
Yeah, it's that simplistic, and that's what shocks me about these doctors and therapists. Looking back at my notes when I transitioned, yes, I was 21, 22, but I was still very immature. And I think, well, we know your brain doesn't fully develop until you're about 24, 25, which, funny enough, is when I woke up and went, I don't think I'm trans, actually. I don't think anyone should transition under the age of 25. Simple as that. But yeah, I just don't think any child ever should be allowed to do that. And I include myself in that I was not 25. My brain was not fully developed. Therefore, I cannot understand the long term. But the notes say I understand the long term. Well, we've talked to her or him, and he says he fully understands. No, I don't even remember this conversation. I did. I think I misunderstood what they were saying anyway. If I had some sort of neurological thing wrong with me, I had the symptoms of autism, which I don't anymore, by the way. Long story there. Either my mother had just sort of gaslit me into that, or they were just symptoms of my autoimmune digestive issues. Because now I'm a carnivore. And after being a carnivore for about a year or two, I could look people in the eye. I didn't go on long tangents that weren't relevant to anything, or I wasn't basically just talking at a wall, basically. No sensory issues. I didn't need to wear headphones on the bus. I could do handshakes. It was all fun. So should be a little column A. But
yeah, I do wonder how much the current, especially American diet, has to do with the incidence of autism, because we seem to have so much more of it than any other country. And what's that about?
Oh yeah. Yes, so there's a really great book called Brain Energy. I go on about it a lot on my channel, but Brain Energy by Dr. Chris Palmer. He's a neurologist, 30 years experience, and he was really determined to uncover the underlying principle of all these illnesses. Why we have so many chronic illnesses, mental illnesses, cancer, all these. Why do we have so much of this in the Western world, particularly in the United States? And what he decided or realized was it's metabolism. Our modern world, our diet, our the light we expose ourselves to with screens, lack of touch and contact time in nature, temperature. We live in temperature controlled environments. We wear shoes. We sleep in soft, comfy beds. And he doesn't talk about those last two things, but I'm realizing those are a factor too. That we are making ourselves sick through convenience.
Mm.
And so more cancer, more ADHD, more autism, more gender dysphoria. It's because we're wild, we're apes. We've put ourselves in a cage, a concrete cage that we built ourselves, with not enough light, not enough social contact. Now we're going insane. So yeah, Chris Palmer goes into way more depth about it than I do, but that's the cliff notes there.
What do you remember about the assessment process when you decided you wanted to transition? What did that process look like when you reached out to a clinician?
Oh my God, yeah. So it was such a joke. So I went to the GP that I've been going to since before I was born, the family GP, and he just went, "No, I don't think you're trans." And we'll see. He was right, but I think the way he went about it was wrong. It was just dismissive. No, it's just a phase. Just wait, you'll get over it. No, if someone is going through a delusion or this fixations, anxiety, whatever it is, that's not really going to help. He really needed to intervene more and speak up. So what he could have done was just say, "Look, I've known you since you were a fetus. I watched you grow up. I got all the notes on all your behavior up until now. And that takes more time and effort, I suppose." But he knew me very well. Even if he didn't have to read those notes. He knows me. So yeah, he should have just talked about that and just gone, well, based on past behavior, this is what I think it is, or let's watch and wait, not dismiss. I was his patient, and I think he should have taken ownership of that and go, okay, a little concerned here, so I'm gonna just I didn't know about this in Australia. There's a thing called a mental health care plan. And I'd never heard of that until after I detransitioned. It's ridiculous. Well, no, just before I detransitioned. The mental health care plan is where you are entitled to about 10 free sessions through Medicare of therapy. Why did no one tell me that? Because I was having to pay for these things myself. So that hurt me. My GP hurt me. Instead of just saying, okay, look, when you go see a therapist, I'll write you a mental health care plan. You can just talk to them, see what happens. Nah, he just dumped me. No, I don't think you're trans. Anyway, moving on. Your blood test. Let's talk about that. And it was never brought up again. So then I talked to a friend of mine who says, oh, my GP's a little bit more LGBTQIA positive. I don't know how many letters we had in the alphabet at the time then. But yeah, she takes me to her GP. The GP says, oh, well, I'm very happy to help out. I've never done this before, so I'll get back to you. I'll do some research, and I'll see what we need to do as the next steps. Next appointment, she said, okay, you want to see a psychologist and a psychiatrist. So you have you need a letter of referral from both. Then you'll be sent to an endocrinologist. So we'll put you on the wait list to the endocrinologist now and go see the psychologist and psychiatrist. Again, never mentioned, this is a different GP. She also does not mention mental health care plan. You don't have a job, you are dealing with chronic fatigue syndrome. Oh yeah, did not mention, I'm very complicated. I got Barmer forest virus, like Ross River, that's a more famous one. A mosquito-borne virus that causes fatigue. And so I already had immune issues, had terrible periods, had IBS from this gut microbiome situation issue. And then I get the forest virus, and I just do not get better. I just have permanent fatigue. We don't know what's happening. I don't even remember being bitten by a mosquito, or I didn't think much of it. And then they do the blood tests and discover I did have this virus. And then it was somewhere after that point, around 21 years old, I'm just totally introverted. I can't go out. I can't do anything. I don't have a job. I've had to stop studying my costume design course. I dropped out in second year. It was devastating. It was I felt totally useless. I felt suicidal. And then I have this a great epiphany after spending all day, every day on Tumblr. Oh yeah, I'm trans. That's why I feel this way. No, you fucking moron. Sorry, I'm sorry. You moron. It's because you spend all day in bed, not going anywhere, not talking to anyone, no sun exposure, terrible diet. And any doctor should have been able to just say that. Took one look at me, my GP, who helped me get the diagnosis of Barber forest virus. He should have been able to say, okay, well, you've had chronic fatigue syndrome for nearly 2 years now. You don't go anywhere and do anything. Do you think maybe, Courtney, it has something to do with that? But no, he just didn't want, just put his hands up. I don't want to deal with it. And outfit swap.
Costume change. I was overheating. And then my hair looked too ridiculous without the beanie. Sorry, carry on.
Yeah. So second GP again doesn't mention you could get a mental health care plan to help you pay for this stuff. Now, so I'm paying to see the psychologist and the psychiatrist by myself. I get confused. The psychologist, yeah, and she was really nice, and she said, "Okay, you're a complicated case. Why am I always a complicated case, Ron? After my car accident, the head injury. So I had so the nerve here was damaged. I don't need my eye patch. So this week, no eye patch. Great, but this entire side of my face." Paralyzed, 2 skull fractures, whiplash, And then I nearly lost my leg, but they put pins in it. I didn't reject the pins amazingly with my immune system. And yeah, leg healed up fine, but yeah, had a broken leg and a huge laceration behind my knee. And during the recovery, they always said, "Oh, you're a complicated case. It's such a complicated case." Yeah, I know. Everyone tells me that all the time about everything. Apparently, I can't even get injured right. I can't get hit by a car like a normal person. But yeah, so when it came to my psychological evaluation, the psychologist said, "Yeah, okay, there's a lot more to uncover here. I want to take our time, figure it out." No, I'm impatient. Oh, she's being transphobic, gatekeeping. I need to get my drugs in me right now. The psychiatrist, he was terrible. He clearly did not give a shit. I guess he sees a lot of trans patients and he just goes, "Oh, I'll just write the letter for, oh, yeah, whatever. Just don't sue me. I don't want to lose my license." And that's the horrible thing, is there are a lot of individuals like me who are innocent, who are just, they need someone to push back. I think we're failing this generation of kids. They want adults to be adults, to say, "No, kid, I've been on this planet many more decades than you. I know you're experiencing a lot of big emotions. You don't know how to deal with them right now. I know you want an easy solution and you want it right now, but you're going to change. You're going to change a lot. Every year of your life until maybe 25 years old, maybe beyond, you're going to be a different person every year or so. You're going to discover new things about yourself. You don't know it all right now. So I just want you to slow down, think it out. Let's talk it out." But we're not doing that. It's all affirmation of, "Oh, well, you think you're trans? Oh, well, I guess you must be, and you identify as a wolf or you identify as a robot or what?" Yes, go ahead. You know yourself better than anyone. No, they don't. I did not know myself at all. And that's what my channel's all about. Every video is a different subject. And the next one, if I finish altering the costume I want to wear for it, I would make more videos if I didn't insist on making bloody costumes for it. But my
I was
next one's
telling
about
Aaron, I was telling Aaron before we got into this that your YouTube channel, he gave me David Bowie, David Bowie. Am I having a stroke? David Bowie
Sorry?
vibes, just because yeah, it's like a different character each video.
Exactly. Yeah, I love Bowie, and Bowie is an influence. I mean, he's an influence on everyone, let's be honest. But someone who was so bold and willing to jump into and immerse himself in these other identities. And I think to most artists or creative or deviants, social deviants, that's very appealing because I don't know, I guess most ordinary, who's ordinary, but most ordinary people, they're set in reality. They go to work, they come home, they eat dinner, they watch TV, they go out for drinks. It's all tangible, physical, immediate stuff. But I think what our ancestors would have called the shaman brain. There's a lot of research onto this shaman brain, which is fascinating to me. These people who are just very intuitive, they're sensitive, they're dreamers, and there's something magical about that. I love people like that, and I can form deep connections with these people because they're working on this other plane of reality. Is it shamanism? Is it magic? Is it witchcraft? No, but it could be they're an artist, they're autistic, they have hyperphantasia, they have all these other things that just give them this beautiful perspective on the world. Someone like Bowie or another influence of mine is David Lynch. The way he sees the world, that is so inspiring to me. And so that is what I am categorizing as the shaman brain, just for reference. And so I think a lot of people who are transitioning now are these lost shaman souls, shaman brain. They're thinking deeply. They're so sensitive. They're beautiful and amazing, but they're sort of being led down this path that is, for many of them, if not most of them, destructive, because that's not what they are. They're not trans. but they're on this soul journey. They're trying to find out who they truly are and where they belong and how they want to be received in the world. It's a very deep personal journey. And, for me, I feel like I'm sort of coming to a plateau, but does that mean that's the end? Is there somewhere else I go after this? Well, we shall see. Um, we're also the kind who will watch something and then it will become our entire personality. I'm guilty of that. So my next video, I will be dressed as Astarion from Baldur's Gate because I've been playing Baldur's Gate now, so that is my life. But otherwise, yeah, Metal Gear Solid was my whole no, it is still my whole thing, will be my whole thing yeah. This shaman brain, these outsiders, we connect with fiction as guidance to understand how we feel. And what I'm realizing is, okay, so after my accident, I played Metal Gear Solid 5 The Phantom Pain. And it became my whole world. And I would dream about it, and it would just be this really intense connection. And I was aware that, okay, well, before, when I was autistic, when I was transgender, I had this unhealthy obsession with Alien. And I would talk about those movies obsessively to the point that I didn't want to talk about it. I just didn't know how to connect with it. Yeah, it was driving me nuts. I was doing a podcast, Prometheus by Minute, where I reviewed the movie Prometheus 1 minute at a time. So 1 minute of the movie, and then I talk about it for at least 10 minutes first. And it became this obsession. And I realize now what it is I can't connect, or I just don't get that kind of emotional, psychological support from my community, certainly not from my family. And so a lot of people like me are lonely and need understanding, need connection, and they're not getting it from their community, sadly. So they reach out they grab onto whatever they can. And so I think my entire childhood, that was me, whether it was Super Hulock or it was Alien, and now with Metal Gear, it's just I'm trying to fill this void in my heart. And so having detransition, being more self-aware, and playing Metal Gear MGSV, realizing, well, fuck, I wake up in the game. You wake up in a hospital, you lose a limb, although I nearly lost a limb. Your eye doesn't work. Oh, I mean, the character's lost an eye. You're dealing with PTSD. You have amnesia. You have the character is going through everything I've gone through. And so I formed this very intense connection with Venom, Snake, and Kazuhiro Miller, if we need to get specific. And I realized it's because I needed someone to give me guidance and understanding. And it's almost like a shaman who would go on a spirit quest. And in their dreams, they would find these figures, these guardians, these guides, who would bring them to greater understanding. And so, yes, it's a huge tangent, but essentially what I'm saying is a lot of these kids or young adults are the same. They have this shaman brain. They're trying anything to understand their identity. A lot of these kids connect with fiction. And for girls, they will play these games and okay, Metal Gear, sometimes very good depictions of women, but in MGSV, hateful depictions of women. Oh, the only female character does not talk and doesn't wear clothes. Really great. I can identify with her. Yeah. So these hateful depictions of women. And so if you are this lonely girl with a shaman brain, what are you going to do? You're going to start thinking, well, I identify with the male characters. Maybe I should be male. That was a long tangent, but hopefully I got it.
So tell us about the actual transition process for you and what that was like. Once you got that letter, what was the next step?
Yeah, so the psychiatrist, Raiola, and he said there's a high rate you'll detransition because you're autistic. Okay, then it should have stopped there.
Wow.
If he wrote in the letter to the endocrinologist, there's a high chance she'll detransition. So then don't write a letter or referral saying that she should transition. Are you stupid?
That's wild. You still have that
Yeah,
letter?
I have all the records. Yeah, it's, I'm sorry. Oh, yes. So this is my endocrinologist wrote. So I was referred to the endocrinologist. And though I didn't have the letter from the psychologist, so I only had one letter. I went, I'm going to make the appointment with the endocrinologist, and I wasn't even that intent on transitioning. I want to make that clear that at the time I was just sort of confused, and I felt, I have these feelings, and I trust doctors, I trust authority, and maybe she can tell me if this is the right decision for me. Is this what I'm really feeling? Am I really trans? I mean, I feel that I am, but is that true? So I see her, and she does a hard sell on testosterone. Oh, come right this way, young man. You can have all the changes you want. You'll grow bigger and stronger and taller, and you'll have facial hair, and it'll be amazing. You'll be muscular. No downsides, really. I mean, there'll be some genital growth, and you used to have some acne. No, actually, you'll go insane. You'll have even worse autoimmune issues. You'll never be able to eat fruits and vegetables again. Yeah. So, you have chronic fatigue syndrome, 10 times worse than you ever had before. Then you will also develop some kind of psychogenic non-epileptic seizures. Penis for short, by the way, PNES. Yes, I did get some kind of penis. It just wasn't the one I was expecting. So PNES is we have these spasms and convulsions, fainting, paralysis, which is where your brain is experiencing so much stress, trauma, pain, whatever it is, that it manifests as PNES. Some people with epilepsy can also have PNES, and so it's very difficult to identify which is which. But basically, you're relying on people to, family members to film your seizures or convulsions. Maybe you get under an MRI or CT scan, they can see what's happening. But yeah, it's not technically psychological, but yes, I had all these neuropsychological conditions that manifest only after taking testosterone. Then they went to remission. Then I had a brain trauma, and the PNES came back again. So I'm really, oh shit, that's what this was. And most doctors don't know about PNES or neuropsychological conditions. They don't know about autoimmune issues that can arise from hormone. They're just stumbling in the dark. They're prescribing these things without fully understanding. How could I have given informed consent if you don't even know what the stuff does?
Yeah. So it was the endocrinologist that you, when you said they just kind of did a hard sell of testosterone. So that was the endocrinologist.
Yes, and she wrote here in my note, in June 2015, Coulson was assessed by Dr. Gordon Wang, psychiatry. I don't know if I should be saying names, but anyway. But no, I will name and shame. Screw this guy. Psychiatry as being suitable for hormonal treatment for gender transition. He made the important point there is a higher chance of changing one's mind about gender transition with a coexisting diagnosis of autism and gender dysphoria. Coulson understands this. What?
The transition for you, it sounds like, exacerbated a lot of physical health symptoms. And so how long had it been before you decided to discontinue the testosterone?
Yeah. By the way, this is also what my endocrinologist also wrote. So I was trying to get involved with a class action lawsuit that never went through. Long story there. There's always a long story with me. Anyway, but yeah, no, looking through all the notes, they were trying to determine, other than photos of my enormous weight gain on testosterone, there was nothing in the medical notes because I wasn't seeing a GP. I was just seeing my endocrinologist exclusively. And so she wrote just, voice deepening, facial hair, shaving, weight gain of more than 10 kilos of muscle mass. muscle mass. That you think that was all muscle mass. I can show you the photos. That was not muscle mass. But she always frames it that way. Oh, the growth is good. The changes are great. Always. Ugh, holy shit.
But yeah, so how long were you on testosterone before you're like, okay, this is a net negative?
Yes, it was 5 years, and it's shocking to me just going back at looking at my writing and recordings of any scripted social media posts or just any archaeological evidence of my thinking and behaviors at the time. It's this blind spot. It is almost like being in a cult where you are being actively harmed. And I do listen to a lot of interviews with ex-cult members, and I go, that is so relatable that you just when you're socially conditioned to believe something is normal, you do. So that's what we're dealing with here. And I don't even think this is just children. I think anyone who has transitioned, especially for the wrong reasons, who isn't of sound mind or isn't old enough to make these mature decisions, they're just gonna switch off to all the red flags. I'm so laser focused and I want to be a man. If I stop taking testosterone, I'll stop being a man. And that's really, you are conditioned to think that way. I was thinking, I had severe bloating, and I had all the tests, and there was nothing structurally wrong. I was gaining all this weight. I had chronic fatigue syndrome again. So it went into remission when I transitioned, or just before I transitioned. The fatigue was getting a little better. I got on testosterone and a steroid. So it was like I was supercharged. I felt amazing. I was bodybuilding. I was cycling. I was doing everything. I was just energized the bunny. Then I got a cold, just a little minor cold that never seemed to go away. Oh, my nose stopped running, but I just never seemed to get better. The aches and pains, the fatigue. Ah, shit. I got chronic fatigue syndrome again. So I tried different herbal supplements. I tried this, that, and the other. Nothing does anything. Not a single doctor after the bloating, after the fatigue. Hey, maybe some medication. We should stop you taking that for a little while. In any other situation, oh, well, we've put you on antidepressants, put you on different kinds of diabetic medication. You don't seem to be doing very well. Maybe we'll switch your medication or take you off it for a little while and see what happens. Not with hormones. Never once. I've gone right through those medical records. Never once does any doctor, GP, colonoscopy, what do they call colonoscopy? Gastroenterology. Not a single one went, well, she's not on any other medication but testosterone. She suddenly has all these issues after taking testosterone. I don't know, man. Maybe stop taking it.
Did you get any surgeries as well, or did you stop at testosterone?
Thank God I did not. So I didn't have a job, so I couldn't really afford it, but there were certain trans organizations that could help to fund it, and maybe I could get a loan. I didn't know. I was on the disability pension at that point. But yeah, so I went to go see a plastic surgeon, and I don't know if they're all like this, but yeah, he was just a real ghoul. He just, if you want me to cut this off, slice and dice, and yeah, cool, whatever, let's go, man. And I was saying, okay, conscious for the surgery. Oh yeah, man, we could do that. I don't know. Like a tattoo, apparently. Christ. But yeah, COVID happened, and I say actually that was a good thing to make me reconsider, because I went, I don't know what this. I've never lived through a pandemic before. I don't know how bad this is going to get, but I really do not want to be in a hospital during a pandemic. So I'm just going to stop. We'll put the top surgery thing to the side, which I'm glad I did. I like my tits. I like them where they are. Quite good. Very happy. And I never wanted bottom surgery, really, because I mean, even then I was looking at what phalloplasty looked like. Like, that's a joke. That doesn't work. That is not feasible. And are they sexual? So not like I really no one was going to see it. But yeah, being in lockdown, just being even more isolated, not socially interacting with anyone, and just having a lot of time to think, not in relation to anyone else, just my body by myself. And I stopped taking the testosterone because it was just making me so ill. And I would get these rashes, these fevers every time I took the test, even the tiny dose of gel. I wasn't doing injection. And my endocrinologist goes, weird, I don't know. And I actually contacted, he's pretty well known, William Powers. Will Powers is this GP in the United States who I still have emails from him. And he was very knowledgeable. He said, you want alternative androgens. So your body's not metabolizing testosterone well, either at all or anymore. So here's a list of alternative ones that will metabolize in a way that's going to be a little easier for you. Okay. I talked to my endocrinologist, and she went, no, we don't have those. We don't have those. No, not possible. I mean, I've looked them up, and this Dr. Powers just looked them up, and you can prescribe them in Australia. No, can't do it. Me, okay, that's a bit weird. And in hindsight, I'm thinking maybe it's because she doesn't get any sort of financial incentive from those brands. So I said, okay, well, the new sex health clinic just opened up. Could you refer me to them? Because it really felt like she was done with me anyway. I don't know why. It was just maybe I was too difficult. I was asking too many questions. Because in the early days, oh yes, go ahead, do whatever you want, give me whatever you want, I'll take it. But as the years progressed, my health got worse and worse. I'm thinking maybe she did know. I think even though her notes say, everything's wonderful and positive, and well, she's had this huge fight with the family, now she's homeless, or now he's homeless. Now, all these new health issues. Now his life is turning to shit. She never really comments on that. Just, interesting. Nothing to do with the fact that she's transitioned. No connection there whatsoever. But I think maybe in the back of her mind, she could see she was doing harm. So she just kind of wanted to push the problem onto someone else. And by the time I was put on that wait list, by the time I saw that sex health clinic, well, they called me and said, yeah, we just want to do the pre-screening thing, the nurse, the induction, or I can't remember what they call it, new patient thing. And I said, well, because I've had to stop taking testosterone for so long, 6 months at the point, I feel a little different. I think I actually want to detransition. So how do I do that? How do I safely do that? What's the protocol? What screenings and tests should I get? The nurse on the phone, I could hear, could not get off the phone fast enough with me. It was sort of we wouldn't know anything about that. I don't know. You talk to your GP. We don't do anything like that. Really? You're a sexual health clinic. You help transition people, but you don't know how to detransition people. It just never happens. Well, I mean, it's happening right now. So, yeah. So I go to my GP. Who was my GP? No, actually, thankfully, but I had started going to this women's health clinic. They're really good. I really love my doctors there. And so she did all the screening, ultrasounds, blood test, all of that. We really monitored my periods. We'll get into those in a minute. But, that is a kind of care, aftercare, I guess, that we just do not have. And that's shocking to me.
They seem to, like you're saying, they wouldn't acknowledge that it could, all the health problems post testosterone could have something to do with the testosterone. I wonder if that is because there seems to be this kind of understanding amongst the people who prescribe these hormones that they are a cosmetic intervention. They seem to think of them only in terms of what they provide cosmetically, and then they disregard all of the much more kind of fundamental endocrine resulting issues that arise from them. But it just seems to have this very like cosmetic superficial view of what the drugs are being prescribed for. And so when something completely unrelated, or in their mind unrelated, is happening, they're going, it can't be to do with that because that's just giving you a deep voice and facial hair. I think that's kind of the mindset.
Oh my God, yeah, I've become aware of that. Actually, funny enough, because of the car accident as well, that I'm realizing modern medicine has a fundamental issue, and that is that we have divided everything up into specialties. which
Mm-hmm.
really slows down and actually actively interferes with patients getting adequate treatment. We need a more holistic approach in terms of, okay, so I was hit by a car and I have to go to one person for my head injury, different person for my facial nerve damage, which is related to my brain, but no, nerve damage, we'll do that, different department. Okay. And then I have hearing damage. Oh, but we have two different departments. There's audiology, but then there's the ENT, ear, nose, and throat. So audiology will actually do the hearing test. They can do hearing implants. They can do all that. But actually doing ear, nose, and throat stuff, so the actual structural stuff, oh, no, different department. You're telling me I've got to take freaking 6 months in the public healthcare system or in the private system to see, and there's the orthopedic surgeon for my leg. Then there's the physiotherapist for my leg. Then I've seen a freaking 9 different doctors now when it could have only taken one general physician, perhaps, to look at all of it as one and going, okay, head trauma. Okay, so now your brain is really sensitized to pain. Easy. And I'm seeing a pain. It's a pain center. There's a pain coach. There's a pain psychologist. I'm fingers crossed. I mean, they seem pretty promising so far that they actually look at it holistically as, okay, look at all the structural issues. Those are cured. You've healed. Why do you still have a problem? It's neuropsychological. Oh, great, good. We're getting somewhere. I'm not being thrown from department to department, and they're all saying, "Oh, you're fine." And the same thing happens with transitioning, where so it goes to an end. But hang on, so it goes to an endocrinologist for trans men, but I think you can get estrogen as a trans woman just from a GP. But hang on, so one has to be specialized, but the other one isn't. Go figure. But then also, you're considering this is only cosmetic. You're an endocrinologist, and you deal with polycystic ovarian syndrome every freaking day. Excessive levels of testosterone wreak havoc in a woman's body. That. And now you are essentially artificially inducing PCOS in a healthy woman, and you don't think it does anything other than a bit of facial hair and muscle mass or hair loss. No, I mean, we have XY or XX chromosomes, and it's like trying to shove a square peg in a round hole when you're using the wrong hormone. By the way, just side note, yes, men and women have estrogen and testosterone, but in those quantities, you can't shove that much testosterone into that little round hole of XX. It's baffling to me, honestly, that these doctors who studied the endocrinological system for years, most of their lives, are now treating this as just, it's cosmetic. It's going to make a few physical changes. It's like getting a tan or a tattoo.
Yeah. All the special, everything goes out the window when it comes to anything trans. It's that trans exceptionalism. It's like suddenly we're alien creatures whose bodies and psychologies are just completely different than cis people's. It's just like all the rules no longer apply.
And that's the shocking thing. That's what I'm really angry about. And this whole idea of gatekeeping, transphobia, all of that. I believe all the people screaming at the loudest are just the ones who are the most mentally unstable. I'm going to be honest. They're the people who have probably other psychological conditions. They're not mature enough. So they're screeching, but of course the squeakiest wheel gets the oil. Whereas I think,
the cluster Bs ruin our healthcare.
Absolutely. Why are they in the driver's seat? Whereas, I've talked to transgender people, the trans medicalists. You have, the famous ones on YouTube, the Blair Whites and Buck Angel and Mars.
Yeah. Okay.
He told people that testosterone is just not agreeing with him anymore. And I look at him and go, well, you pass as a man, you seem happy as a man, but we are not providing adequate transgender healthcare. We're harming the trans movement is harming transgender people. I think it's harming everyone. It's harming non-trans people who are getting swept up in this. But you are not even evaluating trans people correctly, you it's an experiment. I honestly feel that I was experimented on, and it's not even in a cool Weapon X Wolverine kind of way. I don't get any cool. Well, I mean the decoy is kind of cool, but otherwise, yeah, no. I was experimented on. They just wanted to see what would happen. They don't know what happens in the long term, except they kind of do. I've been doing some digging, as I want to do. We have plenty of research on women bodybuilders who have abused testosterone, female athletes. I think it was these Russian female athletes who were given testosterone. There's a whole documentary about it and their long-term effects, how it affects the children they give birth to decades later after taking testosterone, how it affected their immune system, their sex drive, everything, every aspect of their lives. And these women didn't even understand what was being done to them. They were being given these drugs and not explained
It was like
what it
a
was.
supplement, essentially, as it was described to them, right?
Exactly. And so we do have longitudinal studies. That goes back to, God, 60s, 70s. So that's long enough to go, well, we know it affects birth defects. It's going to be long term. You don't just stop taking this and get over it, because in nature, how would that ever happen? Only if there was something considerably wrong metabolically. PCOS is also another metabolic condition. So what I'm living with now, I'm really lucky. So I have to live a very strict lifestyle of, from morning to night, I have to follow these very ancestral living is the quickest way to explain it. I have to live basically as our ancestors did to protect this very fragile metabolic and immune system that I have now, and endocrine system. So, I've taken to sleeping on the floor. That helps with my phantom pain. I basically I wake up before sunrise now. I blue blocking glasses. I have to be very cautious about the light I expose myself to. Any deviation from this freaking routine, and I notice it. And so when it comes to I know the diet, I have to be a carnivore and all those things. Thankfully, I can still drink spirits. With that, it's getting to how I deal with my menstrual cycle. It seems to be getting better, primarily because thankfully, it's just herbal solution, natural solution. A lot of doctors wanted to push birth control on me. I'm going, no, I am not messing with artificial hormones again. I have learned my lesson. But I thought, okay, well, we could do a microdose near my period, so just for a week, I'll take a tiny dose of some birth control. It did nothing, and I felt worse, and I felt more depressed. And said, nah, okay, no, we're not doing prescription drugs ever again. So I've been doing a phytoestrogen soy cream, and I put that on my abdomen twice a day in the days or maybe a week leading up to the period and during the period. So what's happening is, and I haven't even mentioned this yet, and also none of the documentaries I've been on want to mention this, false pregnancies. No one, people really don't understand false pregnancies in general. But when I detransitioned, I looked around the detrans community and I was asking, hey, does anyone experience this? No one has, or if they do, they just haven't felt comfortable discussing it or didn't recognize what it was. But as I was detransitioning, going cold turkey, just no testosterone, no birth control, nothing. I think in hindsight, maybe you have to just slowly wean yourself off. You can't just go cold turkey. But yes, what's happening is, and I didn't know this, it took about a year, and my GP finally decided. I think what's happening is, so your estrogen and your progesterone, they're in a sort of synchronous rhythm throughout the month. Then you get to your period, and then one goes down, one goes up. There's supposed to be a ratio there. I can't remember specifically how. There's supposed to be an exchange there. One is higher than the other. What's happening is yours just stay constant, or they're going up, or we don't really know specifically, but they're staying fairly consistent. There's no dip from blood test. There's no dip. And what's happening is my brain is going to think, oh, we must be pregnant now. We've been fertilized. We must get ourselves ready. Because you are not supposed to have consistent hormones throughout the month. If your progesterone stays the same, it's a pregnancy hormone. So initially they wanted to give me progesterone, and I did try that for 1 week. Hate it. So then I realized, okay, the soy cream, a lot of postmenopausal women swear by this. There's some decent studies. Don't get me into the whole soy is a whole argument with the vegans, but yeah, no, it is an endocrine disruptor. It is a very effective natural. What do they call it? It replicates. Oh my god! It's a bioidentical, or it's something that looks identical to this molecule. So the molecule for soy estrogen and the molecule for human estrogen, same. So they just come into the same slot. We're not okay. Tangent, but also I find it very interesting that glucose and vitamin C are the same shape. So they overlap. You eat less glucose, you don't need so much vitamin C. Interesting. But yeah, so phytoestrogen works the same, thank God, as estrogen. So I take that during the week of my period. I feel great. My periods went from freaking 40, 20, 30 days random. Then it was 40 days predictably, then 35 days. Last month it was 28. Maybe this month will be 28 again. So I think now I'm slowly getting back into a normal rhythm. But those false pregnancies, they were hell, psychologically, physically, you just feel disgusting. You're all swollen and bloated. I already had all these bloating issues from testosterone anyway. So at first when I was getting that detransition, it was like, oh, it must be just a hormone thing. I'm horribly bloated. Doesn't matter what I eat, it'll pass. No, it stayed. It kept getting bigger. Then my breasts swelled up. Then milk arrived. Then, also, I didn't even mention, on testosterone, I had priapism, which is where the vaginal tissue is erect painfully for a long amount of time. You've got to sit on ice. Oh, yeah, no, the priapism came back.
I've never heard of this.
Hmm?
I've never heard of this.
Exactly. All these conditions, which will happen because of endocrine disruption. Apparently,
and you being a complicated case as well.
I know. So, yeah, I mean, I had to freaking sit on ice, not even masturbating. You know that, well, before, I mean, nowadays I'm more comfortable with my body. I'm not freaking weird about it. But yeah, no, back then I couldn't even just sort of massage that area and calm it down. No, it was so painful. And psychologically, I hated touching myself. And I noticed a lot of trans men are like, not trans women so much, but trans men are what we would have called back in the day stone butch lesbians. These butch lesbians don't touch their tits, don't touch their chest, don't touch them. They want to be on top. They will have sex with you. They'll peg you. They'll do all that, but they don't want touch. They have these huge issues with intimacy. And so what I'm realizing now is what we're seeing with a lot of these trans men. They're just stone lesbians. They don't have another word for it. And you deny people language, you see what happens. But yeah, so for me, I was a little bit like that, where I just had all these issues with touch and my own body, and I didn't like, yeah. So that was something to overcome. But then when I'm flooded with all these female hormones, interestingly though, there's actually a second book I want to make, because I used to do, well, I still do, this outfit. I swear to God, I'm getting to a point. Outfit of the day photos, and I think I started it. No, I started it when I was 20. Not consistently, but yeah, I was taking photos of when I was a girl, then when I was Connor, when I was a man, and my outfits of the day, and then when I detransitioned up until now. And so when I detransitioned, well, partly I brought my mother back into my life. I don't know why. I thought maybe things would have changed. She was very forcefully pushing me back into that very feminine box again. But also I had all these female hormones flooding through my system, so I felt very feminine. And I also went through a somewhat heterosexual phase. It was weird. There was an auto heterosexual thing going on. There was this mechanophilia thing. There was a lesbian thing. I was all over the place. So that first year, it was just a freaking roller coaster. And I do want to make a video on how sexuality can change, especially under certain circumstances. But yeah, that's why to this day I don't label myself with a sexual orientation, because I have no freaking clue, buddy. I'm figuring it out for myself. So I'm just, keeping myself open and just seeing what happens. But yeah, for that first year, I'm glad I didn't date anyone, or I didn't find anyone who wanted to date me, because yeah, I didn't know what I wanted, because what I wanted changed every day because my hormones were just in total fluctuation. And then during those false pregnancies, and I think I would get on average one a year, sometimes twice. They could last a few weeks to a month
And you
until
stopped
the next period
testosterone
came
about
along.
4 years ago. Is that right?
This is my fourth year detransition. Yeah.
Okay.
So year three, yeah, no, year four would have been last November or October, November last year, fourth year. Yeah, wow, time flies. I'm scared. I want to get off the throne. But yeah, so in those 4 years, I have changed so much. I think I stagnated for those 5 years on testosterone. Personality wasn't changing much. I wasn't really learning anything. I wasn't changing. Had chronic fatigue. I stayed home. I made podcasts and slept and enjoyed being a man. Then yeah, so detransitioning was just that first year, and I feel sorry for detransitions. I mean, some of them have an easier time than I did, but some of them probably have a far worse time, especially if you had surgery. That you might be a lifelong patient having to take the sex hormones of your own sex. Having to come back from surgery. I don't know how you do. I honestly do count myself lucky, even though I've gone through all the shit. I'm one of the lucky ones. I'm one of the ones who actually got out fairly unscathed.
It kind of sounds like, I mean,
I
like
got
you were having like hell from the experience and a little while after, but now it's like you haven't lost any body parts you didn't want to lose. You like the fact that you have a lower voice, and that's about the extent of the changes, right? And so it's kind of like on the other side, not much harm done,
yeah,
but it was just like the
yeah,
actual experience of it all was quite hellish, it sounds like.
yeah, because I think there were benefits to taking testosterone. For me, I am happy with the deeper voice, with the different hairline, more muscle mass, even the genital growth is not so bad. Has some advantages. Also, I didn't have a sex drive before taking testosterone. While I was taking testosterone, I mean, I had the physical symptoms of arousal, but I didn't have the psychological attraction yet. That could be attracted to do with the autoandrophilia, where I was just so fixated on the self, so fixated on what I wanted to. I had this idea of the man I wanted to be. I was so fixated on that. Yeah, the advantages that I have now, that I like being somewhat masculinized, and I mean, we'll never know. Am I just making the best of a bad situation, as many people say, or is it I needed to transition to a degree, as some in the trans community say? Oh, see clearly, it's a sign that some people need to transition, and some people need to change even a little bit, and these little changes are going to be beneficial. I guess we'll never know objectively. A lot of these conditions I deal with, we can't know objectively, because getting back to our thesis statement at the beginning of this podcast, when there isn't anything structurally wrong that we can't screen for, everything else is philosophy. It is creating a narrative around the phenomenological, the evidence, the physical data. And so, yeah, this is a story I tell myself, and this story I'm writing in my memoir, seeing this narrative emerge. At least to me, this is the one that makes the most sense. Is it the truth? Who can say? When I detransitioned, I had all these weird sexual. I felt these sexual urges about everything, including my own car. I've talked publicly about that. Yeah, just I think being lonely and not having anyone to explore these things with. But I had this robot delusion. I thought that I was a robot when I was transgender. So again, taking these hormones without any sort of psychological or really adequate physical support and care, it ruins lives. The fact that I went to another therapist and I said, I have this delusion. I think that I'm a robot. I know that I'm not. Am I schizophrenic? What's wrong with me? I don't like being this way. Oh, no, no. And she was a gender affirming doctor. She said, no, I want to affirm your robot identity. I don't want to, tell you how to live your robot life. I should have just walked out of there right then and there. But you're delusional and you want to be a robot. And the doctor's
They're
saying, "Oh, you can be."
actively encouraging mental illnesses, essentially.
At
That's
this point, that's what they're freaking doing.
because this is I think video that we should link to that people can get kind of the full scope of what you explain of your autoandrophilic experience in that video. So
Yeah,
I
that'd
think
be
that'd be a
way.
good way, yeah, to kind of tell that part of the story. But in there, you're quite talking about the fact that a lot of your male identity was wrapped up in this robot character that you
Mhm.
identified with, and is
Yeah.
that the Connor character? I'm not sure of the media that is it a video game or a TV show? I don't know anything about
Yeah,
this
so there
character.
is Connor in Connor is named after Connor in Detroit Become Human, a very popular male character for a lot of trans identified females. So yeah, I was pretty predictable. So well, before I transitioned, I had, I was fixated with Benedict Cumberbatch. Again, such a basic bitch. And I love the guys in Supernatural and all of that. And so I really identified with them and I wish I looked like them and all of that. But then, well, it was actually before I transitioned. Uh, there was that motivation. Then after I transitioned, Alien Covenant came out in 2017, and I fell in love with the Alien franchise all over again. I had this intense autistic obsession with it, and I loved Michael Fassbender. I watched him in every movie. I just thought he is perfect. That torso is perfect. His torso ratio. I want that. I want to be like that. So yeah, I had this intense obsession with him and wanted to be well, specifically David, I guess, in Prometheus, and I bleached my hair blonde and cut my hair the same way and all of that. So it's that shaman brain looking for guidance, looking for your identity, looking for your truth, even if it comes through someone else. And then later on, Detroit Become Human comes out. Connor looks a lot more like me, just he's a brunette, similar facial features and coloration and all that. And I go, oh, I can identify with this character, especially because Detroit Become Human is choose your own adventure essentially. So I can be whatever I want, and I'm already developing this android delusion, and now I go, oh no, but I can live out this fantasy as Connor. Legally change my name. I'm spiraling. I am clearly, absolutely batshit insane, crazier than a bag full of cats. What do people do? I will affirm you. My friends don't know what to do. It's the same. Oh, actually, funny enough, talking to a woman with schizophrenia at a party a couple of weeks ago, and it was really eye-opening. Wow, we have similar experiences. She said, right now, I'm on medication. I'm doing very well. Right now, I am very sure that here, this part of my head, I have a microchip. I know consciously there is no microchip, but there's a part of my brain telling me, nope, there's a microchip there. Yeah, same thing. I thought I was a robot. I know that's impossible and ridiculous, but also there's a part of me that really wants it to be true, I guess. Um, so yeah, my identity was really wrapped up in those characters. I'm kind of doing it the same way now. Although I think it's because I have the physical attributes of the characters that kind of makes it feel a little better that so I guess my two main characters, or three characters that I really connect with. So there's Kazuhiro Miller in Metal Gear. He was on a crutch, I was on a crutch. So it just kind of made me feel more comforted that I'm on a crutch. But hey, your hero, Miller, had the crutch too. I needed the eye patch. Well, Big Boss needs an eye patch too. I have ptosis in his eye. Also, Guts from Berserk. He's a character who he's missing that eye. Eyelid doesn't work. I'm relating to this character just physically. I don't actually want to be these characters anymore. I'm old enough, wise enough, self-aware enough. Except when I'm having my sexual fantasies, then I like to imagine I am those characters. Or Geralt, actually. That's another popular sexual fantasy of mine. Yeah. But I know there's a sexual fantasy. I don't actually want to be Geralt, or I'm going to grow my hair out and bleach it white. No, I just think it would be pretty hot if I was Geralt. And I was with Trish. Trish, sorry.
Yeah, it's good when you can kind of take those kind of impulses and kind of conceptualize them in a much more sane way. Still indulge, appreciate, but also recognize the difference
Yeah,
between that and real life. But well, yeah,
yeah.
there's no luck in kind of distancing the fantasy from real life when your therapist is saying, "Well, you are a robot." Yes. Yeah.
There's no difference between the fantasy and reality. And so I guess is my concluding statement on auto heterosexuality is finding that balance between this orientation, fetish, whatever you want to call it, and your day-to-day life. And so I found a really good balance of, I love bodybuilding. I love watching myself get bigger. I've started to get those striations in my chest and my shoulders. Oh yeah, I'm so excited. I feel so great. And realizing, no, it doesn't make me a man. Doesn't mean I want to be a man, but this subtle masculinization, I like being butch. But also, I like makeup. I like jewelry to a degree. Not as much as my mother did, but finding the right balance of masculine and feminine for me. I like androgyny, and finding, well, what do I enjoy sexually, just exploring. Highly recommend the writings of Betty Dodson. Rest in peace, but she's a hero of mine. She's a sexologist, wrote really fantastic stuff for women, and that really helped me come to terms with my sexuality and just learning how to masturbate and be comfortable with my body. So yeah, finding that balance of having a rewarding, comfortable sex life, even if it is by yourself. There is a Sex for One book written by Betty Dodson, very good. And indulging in those sexual fantasies. And then in my daily life, just, I don't remove facial. Sorry, the only hair I remove is facial hair. I have a little bit of beard. But I don't remove any other facial hair, body hair, except for the facial hair. Oh my God, I can't say this sentence. I can't remove any other hair except for the
That
don't
stroke
shave
I
my
had earlier
legs.
is contagious.
I know, my God. Traumatic brain injury, it's fine. But yes, the only hair I remove is on my face, but my legs, armpits, don't care, because it feels a little bit more masculine. I feel more comfortable that way. I honestly, yeah, when I was removing hair on my leg, I just felt, oh, but it feels so smooth and girly. I don't like this. And when I was on the dating apps, though, I felt this pressure, trying to find a partner. I felt this pressure to conform to these sex stereotypes. Oh, well, they want a woman, a girly girl. No, they don't. You want to find someone who loves you for you. And I think that also applies to a lot of auto heterosexuals, that, if you're a man who feels more comfortable in dresses and makeup, then find a woman who will appreciate that, or find a man who will appreciate whatever you're into.
It's really
So
unsustainable to like butch it up or femme it up for the females. Like
yeah,
like it's unsustainable. Yeah, you might attract a partner better that way, but you're going to be miserable. If you're having to live an uncomfortable lifestyle for yourself, it's just not
yeah.
sustainable and
And
not wise.
yeah, so this is what I think this is the main struggle auto heterosexuals deal with. Phil Illy kind of talks about it the same way. It's just, what balance do we strike between how we really want to present, what's going to make life easy for us in terms of dating and career and all of that, and also comfortable in the bedroom sexually. So there's these three aspects of our life that for most people comes naturally. These normal, whoever they are, people who just go through life and know, well, I'm a straight man, I'm attracted to women, girly women, feminine women. I feel like a manly man. I just, present the same at work as I do at home. There's no having to put on different masks, having to be the David Bowie and having to put on these different facades to survive. I think maybe Bowie did do that. It's almost a survival mechanism, maybe in his own life.
Oh, he was definitely
Before,
AGP. I have no doubt.
oh yeah, I think he's a fascinating man. We can only again speculate on someone's life from afar, but yeah, when you feel that you need to put on these different costumes, different masks, it says something. And as someone in the cosplay community myself, why? And I should have known this. I never cosplayed as female characters. I've never ever looked at a female character in any movie or game and gone, yes, I would love to cosplay as her. No, maybe Maleficent. Maleficent had a pretty dope outfit in the movie, but otherwise, yeah, every other female character is going, the male version's much cooler. I like the male version of that. Or I would do female versions of male characters, like Team Fortress, but I would be a girl version of the spy or whatever. So yeah, I think that was my way of just exploring my orientation, identity, gender identity. But what you were noticing is there are especially girls who, there are some boys too, who they love the cosplay, they love cosplaying, and then down the line, I've noticed a lot of them end up transitioning.
Right. They
And
can't
I
separate
question
it.
it.
Yeah. They can't
They
keep it
they haven't
distinct.
found the balance.
Yeah. Yeah.
And I would really urge any person who, any doctor who is involved with these people who are transitioning, try to find a life balance first. Try to see if it is possible for someone who can find a means of balancing this, because you have to understand HRT, SRS, these are huge changes. This is not cosmetic. This is not temporary. There's no going back.
Well, it's been awesome speaking with you, Courtney. Thank you so much
Yeah,
for telling your story.
Great to meet
sorry I
you.
went on so long.
No, it's all fascinating stuff. Thanks so much, Courtney.
Thanks for joining us for this episode of the Transparency Podcast. If you enjoy our content, please help out our algorithm by hitting like or subscribe. If you'd like to make a donation, follow the link to our PayPal account. On behalf of the Gender Dysphoria Alliance, thanks for your support.